So you're welcome to session 13 of Psyc 337. Session 13, Learning and Behavior Change. Learning and Behavior Change, Part 2. So in this session, we're going to continue the discussion on how learning principles can be used to effect change in behaviors, especially behaviors that are not desirable. So here we're going to focus on the application of some of the learning theories discussed earlier, classical conditioning, operant conditioning, and observational learning. So we expect that at the end of the session, students will be in the position to explain the various behavioral therapies based on classical conditioning, then on operant conditioning, and then observational learning or modeling. So to do this, we have outlined 4 main topics. Behavior therapy is based on classical conditioning, behavior therapy is based on classical conditioning, and the third topic is behavior therapy is based on operant conditioning, and then the last one is based on observational learning or modeling. So relevant text chapters and reading materials are available on Sakai for you. So let's go to the first topic, behavioral therapies based on classical conditioning 1. So when you go back to classical conditioning as a theory of learning, you realize the way we paired the various stimuli, the neutral stimulus being paired with unconditioned stimulus, then later on the neutral stimulus acquiring the properties of unconditioned stimulus and then becoming a conditioned stimulus itself and eliciting conditioned response and so on and so forth. So it was observed by theorists that there are some kind of behavioral therapies that can be used using the understanding from classical conditioning to help in changing behaviors. That is what is called counter-conditioning. There is another one, this systematic desensitization. And then we have flooding, we have aversive conditioning, and other techniques for stopping bedwetting. So let's look at the first one, counter-conditioning. It's the process of eliminating a classically conditioned response by pairing the CS with an UCS. That is pairing the conditioned stimulus with unconditioned stimulus for a response that is stronger than the conditioned response. That cannot occur at the same time with the conditioned response. So in other words, it is a conditioning procedure for weakening the conditioned response by associating the fear-provoking stimuli with a new response incompatible with fear. So in some books, you find out that counter-conditioning is also called deconditioning. Deconditioning. So the next one is systematic desensitization. This is a form of exposure technique based on counter-conditioning, and it works on the principle that it is impossible to fear and be relaxed at the same time. You see, you can't say you are afraid and at the same time relax. So it uses relaxation techniques to really get certain behaviors to be changed, and this is done usually by professionals. The idea is to counter-condition the phobic condition. That is, to take steps to ensure that the phobic conditioned stimulus is counter-conditioned so that the new response replaces the fear response. So steps are being taken to replace the fear response with new response. So the idea here is to replace fear with relaxation. The idea is to replace fear with relaxation. So moving on to topic 2, we continue with the same thing. We look at the part 2 of it. Then we look at flooding. Flooding is another technique that was developed by Joseph Wolpe, used to treat many of the same anxieties as we described in the systematic desensitization. It involves real and not imaginary situations, although sometimes imaginary situations can be used in conjunction with actual exposure. So how does it work? It works on the principle that the fear and anxiety that the individual experiences cannot last indefinitely. That is, with time, the client will become relaxed, and it pairs the relaxation and nothing unpleasant happens with the phobic situation. For example, if a person has snake phobia, the therapist will put that person in a room with snakes in a cage. Snakes in a cage, secured, so the person will not be harmed in realistic situations. And let the person stay there until the fear subsides. Will stay there, will still be afraid, but the snakes will not come out to harm him or her. That fear will take on for some time, but a time will come that it subsides. So it takes less time to implement, but it involves considerably more discomfort for the client. Some people have questioned the rationale for that. It requires the client to be flooded with high levels of fear for prolonged periods of time. Let me state here that it's usually done by professionals. At your level, I will not encourage you to attempt it. It's not advisable. In any case, you are not a qualified psychologist yet. So you hold on, you don't try such things despite all jokes with your friends. Just take care of that. Now the next one is aversive conditioning, which is a technique used to help people break unwanted habits by associating the habits with very unpleasant stimuli. So sometimes it becomes very important to get people to break unwanted habits. So this technique is usually used, aversive conditioning. So in aversive conditioning, there are similar situations and associated behaviors that are attractive to the client, but which both the client and therapists regard as undesirable. Such stimuli and behavior are therefore associated with an unpleasant, unconditioned stimulus, such as nausea-inducing drug or an electric shock. These are aversive. Aversive conditioning has been used in cases of alcoholism, substance abuse, smoking, and sex deviance. And it worked especially when professionals use them. There are several other stages and techniques that are there and opened only to professionals to use. Then we have, the next is technique for stopping bedwetting. Sometimes it becomes an issue. Bedwetting becomes an issue and needed to be stopped. So with classical conditioning, this problem can be handled. In such a situation, an alarm bell with a pad is attached professionally, of course, or put under the individual whilst he or she is asleep. So what happens is the bell will ring whenever any moisture reaches the pad, and the individual then wakes up. Of course, the bell is what is waking the individual up, but something triggers the bell to ring. That's the urine. Triggers, when it gets to the pad, the bell will ring, and this actually gets the client to wake up. So with time, the person comes to associate the full bladder with waking up. So a time comes when he or she wakes up as soon as his or her bladder is full, even before the alarm goes off. So he does not urinate in bed and wait the part for the alarm to go off before waking up. So with time, this procedure gets the person, waking the person up anytime the bladder is full, so that it doesn't urinate again, till it gets to a point where the urine and the bedwetting stops. So that is it for topic 2. Let's look at topic 3. Here we're going to consider the techniques based on operant conditioning. Operant conditioning. You remember our discussions on operant conditioning with the reinforcement and punishment and all that. In therapy based on operant conditioning, desirable behaviors are reinforced immediately and appropriately using the suitable reinforcer, the same way as undesirable behaviors are decreased by punishment and extension. So it's been used effectively with many different problem behaviors. Of course, it's used to teach new skills and to increase the frequency of people's adaptive behavior in a wide variety of settings, and so on and so forth, knowing when to reinforce and knowing when to punish appropriately. So with this, the treatment approach used to help change behavior are also termed as behavior modification techniques. So with this, these are the following therapy-based techniques. Token economy is one, contingency contracting, behavioral self-control, social skills training, and biofeedback. So let's take each of them, look at them briefly. Token economy. This is a form of behavior therapy used to increase desirable behaviors and decrease undesirable behaviors with the use of tokens. How does it work? How does a token work? So tokens function as money, in quotes. It functions as money does in our economy. So you can use token in exchange for items. They were therefore considered as secondary reinforcers. You know what they are? I mentioned secondary reinforcers in one of the sessions. They could be used to exchange for primary reinforcers such as food. So tokens could be used to be exchanged for privileges. When the right behaviors are emitted, one gets a token, keeps it. When you get enough, you use it to exchange for something. For instance, you can use it for getting children to behave well. If you do your homework, anytime you do your homework, you take this paper, write on it, 1, 2, until it gets to a point. If you get about 5, come and give it to me, I'll give you a chocolate, a bar of chocolate. So that can be used. It's one of the strategies, kind of reinforcing gradually and getting to change behaviors. The next one is contingency contracting. So with this procedure, a written agreement is drawn up between the therapist and the client, or a teacher and a student, or it can even be between a parent and a child. So what happens is the contract states a series of behavioral goals that the person hopes to attain. So in that, it helps in monitoring whatever is being done. It specifies the consequences if the individual fails to achieve it. So if the goals are reached, usually some explicit rewards such as money or additional privileges could be allowed. So this is a kind of a contract that is considered to monitor behaviors, get people to put up the acceptable behaviors. So the contract also states negative consequences if goals are not met. So both parties, whether parent and child or student and teacher, will agree on exactly what behavior each desires from the other. And the behavior, along with the rewards and sanctions, are stipulated in the contract, which all parties will sign. So what this technique does is particularly useful in the solutions of sometimes marital problems, family conflict, and can also be used in mental institutions sometimes. I repeat again, sometimes you really need to be sure you have the qualification professionally to engage in this. You don't want to try it on your friends. The next is social skill training. As the name implies, it is used by sometimes teachers, therapists, and trainers to help persons who have difficulties relating with others, especially in social settings. So this social skills training help individuals to learn how to act appropriately in the company of other people in a variety of different situations. So the assumption is that when people improve their social skills or change certain behaviors, they will raise their self-esteem and increase the likelihood that others will respond favorably to them. So it can be done either on individual or group basis, using discussions or role playing. So they tend to appear shy. Those individuals with challenges, social challenges, tend to appear shy, awkward, and odd, and have difficulties expressing their feelings. So when you take these steps gradually, you'll be able to get them to develop the social skills needed. So we call it social skills training. The major goal of this technique is to teach people who may or may not have emotional problems about the verbal and non-verbal behaviors involved in social contracting. So the next looks a bit technical. So this biofeedback is a treatment technique in which individuals are trained to improve their health and well-being by using signals from their own bodies. What we're talking about here is that a person learns to control internal physiological processes such as blood pressure, heart rate, respiration speed, skin temperature, sweating, and so on and so forth. So the individual receives the feedback in the form of lights, clicks, changes in sound, volume, or display on a screen. So when you remember Thorndike's law of exercise. It states that practice of behavior with feedback produces learning. So practice of behavior with feedback produces learning. In the same way, biofeedback techniques used by therapists to control physiological processes of clients by providing continuous feedback to the physiological responses. The next here is about behavioral self-control. So behavioral self-control. With this, an individual is trained to manage his behavior or her own behavior. So he's made aware of the factors that control his or her behavior. For instance, positive reinforcement for desirable behavior, and is made to set goals and try and achieve these goals for which you get the required reinforcement. Goals are set, and if they are achieved, the individual reinforces himself or herself. However, if the person goes contrary to the set goals, he or she punishes himself or herself. So let's look at an example. An example in setting a goal to stop drinking alcohol could be this. If in a week you don't touch the bottle, you reinforce this by buying yourself a special gift, something you really want, or giving yourself a special treat. So this could be some of the goals that you set. So the person goes by this, he gets the gift, the special thing that he has or he wants to buy for himself. If you falter and drink alcohol, or if you make a mistake, you don't go by the goal that we set and you drink alcohol, you don't buy yourself anything, or you don't do anything that takes you to reward yourself. So which means that you will not get what you said you want for yourself if you go by the first point. So in this kind of situation, it's important that you remove all the cues, all the prompts that will cause the individual to put up the undesirable behavior. For instance, if you want someone to stop drinking, you ensure that it doesn't keep alcohol in the fridge. or even in the house, you ensure that there is no alcohol in the house, so the person will not be tempted to go near the alcohol. You can use it for people to quit smoking or reduce excessive weight, etc., given the strategy that we set. You just have to set goals and make sure you go by the goals. So that is it for the operant conditioning. Now let's look at topic 4 for the therapies based on observational learning. Therapies based on observational learning. So with observational learning, you know that already where individuals or where there is learning by observation of a model's behavior. So behavior therapies use modeling to actually establish new, more appropriate behaviors, such as social and work-related behaviors. And they also use this approach to eliminate some forms of phobia and also get people to be assertive when they are dealing with people in teamwork and so on and so forth. So observational learning approach. Of course, the principle, this is based on the principle of observational learning, which is about behavior or learning by observation. So behavior therapists here will use modeling to systematically teach people new skills and ways that they will handle their fears and their anxieties. So it's been particularly effective, especially in the treatment of phobias, as observed by Bandura and colleague. So they argue that fear may be learned from watching others being fearful. Therefore, it can also be treated through modeling. So it is simple. Here it's saying that if people fear something because they observe other people fearing them. For instance, why do you fear darkness? Where did this start from? Who teaches the child to fear darkness? Maybe they observe others being afraid of darkness and putting in place things to ensure that there's no darkness, so they also begin to fear. So if fear, for instance, can be observed, and because other people acquire fear, and it's a problem, and you want to treat that problem, a kind of phobia you want to treat, then you can also treat that problem by getting them to rather model others who are not fearful. By that, they get to eliminate the old situation of fear and now replace it with not fearing. Replace it with not fearing. So modeling can be used to treat several other phobias, such as fear of the dark, fear of dogs, dental phobia, and so on and so for true modeling. So when modeling is used to treat fear of dark, for instance, the client observes other people entering the dark with no adverse effect. So there's darkness, so you observe it, the person walks, enters it, comes back, and nothing happened to the person. So gradually the person, the observer or the learner then also picks that habit of not fearing the dark. Not fearing the dark. So the use of modeling to treat phobias may be done in real life situations, or it may also be done through watching of movies and videos and so on and so forth. There is also the approach of role playing. It can be used, modeling can be used to teach new skills when you have role playing being used. In terms of rehearsals, where the client is asked to take on and act out a part which illustrates another point of view than his or her own view. So this helps the client to take on the role of another personality, a more appropriate one. So gradually, the person gets to learn skills that initially they didn't have. So last but not the least is assertive training. So with modeling, assertiveness training can be conducted to help individuals to develop more effective ways of showing both negative and positive reactions in terms of their views and attitudes towards others without necessarily being rude. So social skill problem of non-assertiveness can be handled. A person is assertive when he or she stands up for his or her rights in such a way that the rights of others are not violated. you are assertive, if you say what you want to say in the way that you don't violate others, you don't step on others' toes, and so on. So this individual can express their personal likes and interests spontaneously. They can disagree with people openly and say no when there is the need for them to say no, and say yes when they have to say it, and say it at the time that they want to say it in a way that will not offend others, and so on and so forth. So with observation, getting people to play roles, getting people to observe, to watch movies, to watch videos, this using the concept of modeling and observation, be able to change behaviors. And of course, I repeat, let's be professional, because with professionalism, you'll be able to do things right. At the moment, with your level, you are not yet psychologists. I advise you go through the processes and get trained effectively. In addition to your skills and the knowledge you're acquiring, you engage in practice that will really get you. If you really want to use them, you need to pursue your course further to get to the point. So with this, we've come to the end of this session, which is the 13th session and the last session for this course, Psych 337 Learning. Thank you very much. Enjoy your study, and then always refer to the other sessions if you have the need for that, and you'll be able to make it. I wish you the very best. Thank you very much.